Hello everyone, I am Dr. Sandhya. I am a consultant obstetrician and gynecologist practicing at Cloudnine Hospital, Sarjapur Road, Bangalore. 20 to 30% of patients develop yeast infection during pregnancy. It is more common in cases of gestational diabetes mellitus patients. So, yeast infection can be asymptomatic, in which cases we need not treat the infection as such. If left untreated, usually it is not going to harm a baby. But if the patient is symptomatic, then definitely treatment is required. The common symptoms that patient presents with yeast infection are, there can be intense vaginal itching with soreness of vulva, vagina, redness, inflammation. There can be disturbance in the urination, and there can be lot of vaginal discharge, which is usually described as thick, white and cottage cheesy type of discharge, which is associated with this yeast infection. So, once the patient comes to us with these complaints, we quickly do a per speculum examination, and once the diagnosis is made, the treatment is in the form of vaginal suppositories and topical creams, which will they are harmless when given in pregnancy. So, and usually in another 2-3 days, the patients usually experience a betterment, and then the symptoms tend to reduce. If the itching is very severe, we can also consider adding antihistaminics for a 3 or 5 day course, which will help in reducing the itching symptoms, especially which is more at night time. What are the measures to reduce yeast infection? So, we usually educate patients to maintain a personal hygiene. We'll tell them to clean themselves after every loo visit. The wiping of the genital area should be from front to backwards. We advise them to wear a loose cotton underwear so that there is better aeration. We tell them to avoid hot baths or bathtub baths as such. They are instructed to take a shower immediately after use of swimming pool, to change the damp clothes as soon as possible. And in case if there is yeast infection or if there is gestational diabetes mellitus, patient is instructed to control her blood sugar levels, so that the yeast infection can get cured and it remains under control. There are certain food products or food items which are likely to predispose or trigger this yeast infection. Mainly it is sugar. It can be sweet, honey or sugary fruits like mango, banana. It can be a starchy vegetables like potato, corn, sweet potatoes, packaged processed food, canned drinks, energy drinks, and usually dairy products. These are the most common things which can trigger yeast infection. And also there should be absolute abstinence from caffeine and alcohol intake. This will also help in reducing the yeast infection, and patient can get better after treatment if they follow these basic measures. Measures to reduce yeast infection. We advise patient to have a good personal hygiene. We tell them to avoid hot water baths or bathtubs. We tell them to take an immediate shower after swimming pool visit. We tell them to wear loose cotton underwear so that there is better aeration and less chances of yeast infection with that. We instruct them to change the damp clothes as early as possible or as soon as possible. They are instructed to avoid scented pads or panty liners. If the patient is still using pads or panty liners which are non-scented, they are also supposed to change it very frequently, say in less than 4 to 6 hours, irrespective of whether it is stained or not. And there are certain food items which can actually trigger yeast infection, which we usually tell or instruct patients to refrain from those food items as such, which can be sugar in the form of sweet, honey or sugary fruits like mango, banana, dairy products, packed foods, or canned drinks, energy drinks, starchy vegetables like potato or sweet potato, and absolute abstinence from caffeine and alcohol will also definitely help in reducing yeast infection as such. Patients with diabetes or gestational diabetes mellitus are advised to keep their sugar under control so that yeast infection can get cured as early as possible.